Hello and welcome to YouTube channel HealthQ, the place where our mission is to motivate you and help you to move on to the brighter side of the health. Whenever there is a talk about chronic pain or pain management or lifestyle related to postural issues and ergonomic challenges, usually we talk more about hunchback, which is also called as upper cross syndrome. But very rarely people talk about the lower cross syndrome, which is also a very common problem. What is this lower cross syndrome? How it will impact into your musculoskeletal or your overall health and well-being? We are going to talk all of that in today's video in this chronic pain series. So make sure to stay tuned and watch this video till the end. Let's begin. So friends, whenever a person experiences chronic pain, especially around the lower back region or around the hip region, pelvic region, there are a lot of imbalances involved. And one of the commonest imbalance that people have is in medical terminology called as lower cross syndrome. Now, what is exactly this lower cross syndrome? So lower cross syndrome is nothing but an imbalance in the lower region, starting from your trunk, your pelvis and your hip region in the group of muscle. So here what will happen? Certain group of muscles would be tight and certain group of muscles would be weak. This tightness and weakness combination eventually lead to changes or imbalance in the postural pattern, leading to multiple musculoskeletal issues like hip pain, back pain, knee pain, ankle pain, etc. It could also lead to some chronic problems like lumbar radiculopathy, slip disc, etc. Hence, identifying this lower cross syndrome early on and correcting it as early as possible is the key to stay pain-free. So it's important to watch this video today if you who are someone who experiences repeated pain, unexpected pain, unidentifiable pain in your lower back region or else somewhere in your upper back region also or else in the leg region also. Today we are talking about lower cross syndrome. Let's get started. Hello friends, my name is physiotherapist Meghna Dave. I am the founder and CEO of HealthQ Rehab. HealthQ Rehab is a digital community and a physio rehab platform for people with movement related disorders. And what we do is we provide condition specific rehab program to you, which is designed and delivered by expert physiotherapists. And one important component that we very deeply deal with is postural imbalances and the issues, correcting the issues related to it. And one most common postural imbalance, as I said, is lower cross syndrome. So what exactly is this lower cross syndrome? Well, lower cross syndrome is nothing but result of an imbalance where there is an issue with the muscle strength and there is an issue with the muscle tightness for certain group of muscles which are lying in your abdominal region, in your pelvic region and even in your leg region, or as thigh region even, to be very specific. These imbalances can occur whenever there is a constant load or else constant abnormal or wrong movement pattern maintained for a very prolonged period of time. At this situation, certain group of muscle will stay shortened for a very long period of time, eventually developing tightness, and certain group of muscles will be lengthened for a very long period of time, eventually leading to weakness. And this would happen in relation to each other. Hence, in lower cross syndrome, there is overactivity or tightness of certain group of muscles and there is underactivity or weakness of certain group of muscles. Now, what are these muscles which are tight or else which are overactive? And so what are the group of muscles which are tight or are overactive and what are the group of muscles which are weak or else underactive? The muscles which are tight are your lower back muscles, which muscles are erector spinae, multifidus muscle of your lower back region, quadratus lumborum muscle of your lower back region, latissimus dorsi muscle, and opposite to that on a diagonal pattern in your thigh region, the muscles which is responsible for your hip bending, which is iliopsoas muscle, is also tight. Rectus femoris muscle is tight and tensor fascia lata, the muscle around the thigh on the outer side of the thigh, is tight. That's why a person feels limitation or stiffness in this thigh region. At the same time, the back thigh muscles, which are also called as hamstring muscles, are also tight. On contrary to that, there is weakness in the deep abdominal muscles and on the back side, the thigh muscles or the hip muscles, which are called as the gluteal muscles. This cross section or cross imbalance eventually lead to altered postural mechanics, hampering the muscle's ability to withhold the erect posture, leading to multiple problems of day-to-day life like chronic pain, musculoskeletal pain, sometimes low back pain, your sacroiliac joint dysfunction, your hip joint pain, etc. So how we can correct this problem? Since this is a postural problem, it has a lot to do with your lifestyle. That's why lifestyle modification plays a very crucial role. So if you are someone who is suffering from this lower cross syndrome, make sure to get yourself checked first from a physiotherapist. At HealthQ Rehab, what we have is we follow a different assessment approach where we used functional softwares to analyze your posture based on your photographs that you provide. We identify the group of muscles which are tight and which are loose, and we come up with a complete plan of exercise based on identification of the muscles which are tight and which are loose. The muscles which are tight needs to be lengthened, so a set of stretching exercises is provided for that, and at the same time the set of exercises is given for strengthening purpose to the muscles which are weak. For example, if the tightness is found in the lower back muscles, then exercise like shell stretch, quadratus lumborum stretch, latissimus dorsi stretch, hamstring stretch, iliopsoas stretch, tensor fasciae lata stretch is given in order to reduce the tightness there. At the same time, strengthening is done for deep abdominal muscles with the help of reverse SLRs or reverse crunches, at the same time gluteal extension exercises and stuff like that. Whenever we combine these exercises, what we achieve is a reversal of the posture correction. So a person who has developed altered movement patterns can gradually come to a natural balanced pattern, and then the patient is taught to avoid certain postures and position, at the same time is encouraged to follow certain postural pattern. A lot is done to raise awareness about the right postural pattern, right muscle activation, and thus helping patient to move better in the life. If you are someone who is experiencing from this chronic pain due to this lower cross syndrome, I would highly encourage you to reach out to us and take an assessment for yourself to identify at first place whether you have this lower cross syndrome or not. And if you have been identified with this, then go for this assessment, go for this management, not with us, maybe with some other physiotherapist, but make sure to do this, because this will help you to stay away from the chronic pain that you are experiencing day in and day out. I hope through this video I was able to explain you the entire pathology behind this. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.